So moderating today is our National Perspective panel leader, Coulston. She's the Chief Financial Officer for the Mississippi Development Authority. Let me tell you something, ladies and gentlemen, she's the unsung hero over there. She's the one that puts all the numbers on the paper and makes these projects really come together. She's the Deputy Director of MDA, assisting the state in business recruitment, retention, and expansion activities, is responsible for coordinating state-funded incentive programs and developing incentive packages for industry. She holds an MDA from Mississippi College, a bachelor's degree from Mississippi State, where she studied accounting. Ladies and gentlemen, this is a lady who is a rock, a bedrock of success for Mississippi. Please join me in welcoming our moderator, and she'll introduce our panel, Coulston.
Thank y'all. I appreciate that. This has been a great conference, and I've kind of decided healthcare is kind of important, and what y'all don't know is when I make that decision, we generally start moving pretty fast at MDA, so I'm pretty excited about that. We've heard some great things, and so today what we thought we would do is we would look at some success stories outside the state, and we've got a great panelist today. The first is Stephen Coulston of Broaddus Planning. We also have Brad Guest with Subsidium Healthcare, and Dr. Malcolm Portera, who's the Chancellor Emeritus at the University of Alabama System. First, I'm going to introduce Stephen Coulston. He's the president and managing principal of Broaddus Planning in Texas. He's a licensed architect and holds a degree in architecture from Texas Tech. He's focused his professional career of more than 2 decades on planning projects in institutional settings, government, and higher education. If y'all don't mind, help me welcome Stephen.
Thank you very much, Kathy. I appreciate it. It's a real pleasure and honor to be with you here today. And among such a distinguished group of panelists and amazing expert and industry leaders from around the state, around the country, and around the world joining with us here today. I have to say it's also a great pleasure to be able to look out and see so many familiar faces in the audience that my colleagues and I have had the great pleasure of being able to work with over the last 6 or 8 months and more. I see CEOs and administrators and leaders of hospital systems, mayors and representatives from county boards of aldermen. I see economic development leaders from the communities and business and other community leaders that have been a part of this process. In working to develop healthcare industry zone strategies and plans throughout the state of Mississippi, from the Gulf Coast to North Mississippi and East Mississippi, all the way into the Delta. It's been a wonderful time, and it's been great working in collaboration with the leadership in the governor's office, and a special thanks to Trey Hairston, who I think without a lot of his endorsement and tireless hours and nights and kind of pushing this initiative forward, really may not have been realized. But I could go on for quite a while about the healthcare industry zones and plans and strategies, and you're going to hear much more about that this afternoon. As Kathy mentioned, what I have been asked to visit with you a little bit about is what we've seen in terms of some national perspectives, some trends in other locations, and I guess I'll share another Texas perspective, Blake, following up on Dr. Wernerdy here. But one of the things that I'd kind of like to begin in discussing a little bit about that is this quick graphic, because I think it puts in context a lot of what we've been talking about today. The column that you see on the left in blue represents healthcare services employment growth. And when you look at the columns to the right of that in black, they basically represent that employment growth is happening at more than double the increase of what we've been seeing in what we're seeing in population growth. Now, what that ultimately ends up meaning is, as Governor Bryan alluded to just a moment ago, there's a significant growth happening in the baby boom population. And that's going to continue beyond the 65 and older years. Now, this graphic that you see here is a representation, a snapshot from 2010, looking backwards. So if we start looking forward over the next decade and we start thinking about the increasing number of baby boomers that are reaching and passing that 65 mark, we start to see an even greater impact on this. So you do have a market out here, and you do have a real tiger by the tail and an opportunity to look at healthcare as an industry strategy for economic development. Because the increase in per capita spending from 1960 was about $144 is now exceeding $4,000. So I just want to put that as a little bit of context. I think it's good. Bob Hess alluded to this a little bit this morning, and I think it'll provide some context for everything that you'll hear throughout the rest of the day. Now, as we start thinking about some of the practical application and understanding and the leadership with the governor of kind of understanding this, one of the things that he shared was even looking outside of the state of Mississippi at other examples. And we saw some really great case studies that Bob Hess shared with us earlier this morning. And I think the tour that the governor and others from even in this room actually took a few years ago to the Texas Medical Center had a lasting impact. And shortly after the governor took office and after the legislative initiative with the healthcare industry zone was passed, we had the opportunity to, my colleagues and I, to host a delegation from the governor's office in Mississippi. And we, from Mississippi in Texas. And we went and we visited the largest urban medical center in the world. And we're amazed at some of the incredible things that were going on at MD Anderson Cancer Center and the Texas Children's and many of those. We also came up to the city of Austin, where I'm from, and we talked a lot about the innovation economy. We have some of our leaders who talked about the whole transformation of the innovation economy, which I think Dr. Patera is going to talk a little bit more about, and how that integrated into a whole transformation of Austin as such a destination community that we hear about around the world today. We also met with the University of Texas folks who were talking about building the first new medical school in nearly 30 years and a brand new teaching hospital to accompany that. But then I think while it was staggering to look at the incredible size and density of a place like the Texas Medical Center with those densities that Dr. Minerdi, I guess, are surpassing Manhattan, right? And Houston, which is the fourth largest city in the nation with a population, that surpasses the state of Mississippi. We went to the little towns of Bryan and College Station, Texas, the home of a little college, of Texas A&M University. And I remember very clearly that day that Trey Hairston was with us, and he something kind of resonated as we were taking that trip over to Bryan College Station in terms of kind of starting to create another connection back to Mississippi, as we had to pass through a cotton patch or two to get to Bryan College Station. But I want to tell you a little bit about the story there, and I want to tell you a little bit about the context and how that practically applies in terms of innovation. So as we start thinking about innovation economic development, it's really about this whole notion of the conversion of knowledge and the commercialization of applied research. And that is, we started looking at practically applicable within the context of a region that we've referred to as the Research Valley, and ultimately as an area referred to as the Biocorridor. We started looking at what that means in terms of the practical application of that within the Biocorridor. What does innovation mean there? In this case, it was the idea of facilitating emerging science and technology ventures into jobs, into investment, and to expanding in a global market. And part of the big concentration in that area is we looked at how we could really strengthen these partnerships. We're moving upstream into ideas of innovation and prevention and preventative medicine and the tacks that we could take early on to deal with this transformational change that we see on the horizon related to healthcare. So sharing a little bit about that case study, the Research Valley One Health Plus Biocorridor. It's in Bryan College Station area. It's in the zone that's kind of referred to as the Texas Triangle. It's a home of one of the flagship land-grant research universities with one of the top-ranked colleges of veterinary medicine in the United States, and also the home of the the Health Science Center for the Texas A&M University. As we talked about other parallels to Mississippi, it's also where the Rural Health Medical School in Texas is located. But it also has a really low cost of doing business. And it also has access to really talented and motivated workers. And what we started looking at here was the concept of a One Health Plus Research Valley Biocorridor. So the concept was focusing on the idea of creating an international destination, even in little old Bryan College Station, that's focused on research and education and really thinking about this concept of an innovative ecosystem. Now I could, if you want to catch me after this session, I will be happy to talk with you long and hard about some of the really incredible research and commercialization and technology transfer that's going on there. One of the facilities that's in the Biocorridor now, it's kind of interesting is in terms of research. MD Anderson Cancer Center, the University of Texas MD Anderson Cancer Center is actually leasing space in a facility at Texas A&M University, which you can draw some analogies to State and Ole Miss if you want to there. But one of the fascinating things is one of the things that Bob Hess was also talking about this morning is they are leveraging this strategy of human sciences and human health around animal sciences and the research that is going on there and bringing that together with a concept called One Health Plus and bringing in the agricultural component with their Texas A&M AgriLife and the large land grant agricultural research components that they have there. They are in the Research Valley Biocorridor actually set up right now to do vaccine manufacturing for H1N1 virus using tobacco plants. A big transformation from the big scare we heard a few years ago, why it took so long with the chicken and egg process. But really pioneering process. So the other piece I wanted to talk to you about today was the value of coming together with a plan. Not only having vision, but really having plan, which I think is a strong corollary to what we'll be talking a little bit more about this afternoon. We were engaged through a collaborative group and through the Research Valley Partnership with the strategy to come up with a plan, but not one, as John Turner said to me, we're not interested in doing more plans and having things set on the shelf. We're interested in having a plan that's focusing on implementation. And we want it to catalyze substantial economic impact within our community. So we set up a series of deliverables, a concept master plan and a vision, a partnership between public-private partnerships, prioritization in terms of infrastructure. I thought it was really interesting on the survey today that came up as a major priority, quality of place, infrastructure, and investment, and an implementation strategy that looked at a unified effort, bringing multiple parties together, and a funding strategy for action. Now, the critical component of all of this, and I can't say this enough, was all about partnership and collaboration and bringing a lot of disparate parties with seemingly sometimes very disparate interests to the table. We were working with the local economic development group of the Research Valley Partnership, which focuses on that commercialization and technology transfer from the university and the region, the local economic development communities from 2 cities, the cities of Bryan and College Station, which was no small task in and of itself. They were both in a lawsuit with one another at the time of this project. The Brazos County, the Research Valley Partnership, Texas A&M University, the Health Science Center, the College of Veterinary Medicine, Blinn College, the community colleges and workforce development is such a critical component of all this. The AgriLife programs, the Texas Engineering Extensive Service. But those were the people that were sitting at the table and a part of the decision-making process, but we couldn't stop there. It would really transcended just the traditional rooms that, doors that you might get behind and make decisions. It was about broad community support. It was about bringing together groups of people with, in rooms this size to have conversations with economic development and planning and zoning and state and local elected officials who are really coming to the table to think about this process. Now, just like your healthcare industry zone legislation defines a geographic parameter of that 5-mile radius around your hospital, we had a geographic parameter to work with. It was about 3,500 acres of land within the extents of our planning zone, as you see outlined in red there. And it had a lot of folks with a lot of different hats on and multiple different parties with lots of different ownership. I mentioned the dynamic between Bryan and College Station. You can see a line that goes through the middle of the site. This site was bifurcated by the city limit lines of these two communities, and further complicated by the fact the city of Bryan actually owned about 250 or 300 acres within the city of College Station's city limits. It also included property ownership from the A&M system and its various components. What we did through this collaborative process of bringing all these different folks together is developed a vision and developed a concept that was anchored in the health strategy, that was anchored in the plant research strategy, that was anchored in the approach related to animal health and sciences, and pulling all of those pieces together, also tied together in a physical context driven with a place strategy. So this is not just about, drawing up a traditional plan. It was about looking at the best practice models out there, some of which Dr. Winerty was just mentioning that are going on in Denver and San Francisco and all parts of the world, that the kind of innovation capital and the kinds of people that you're wanting to draw are looking for a different kind of place that's walkable, that's urban, and that's friendly to them. This was a 3,500 acre mixed use, health sciences, biopharmaceutical manufacturing and research zone that was integrated with housing and residential and food services and retail and lots of commercial enterprises in a walkable context with green spaces and pedestrian areas around there. So that's a shared vision, that's the concept. In terms of investment, lots of investment's been made, but I think the key takeaway story here is essentially, in July 2012, just shortly after Trey and his colleagues were visiting us in the state, the U.S. Department of Health and Human Services announced the $285 million investment for the Center for Innovation and Advanced Development and Manufacturing. I was talking about the H1N1. Then just earlier this year in the spring, US DHHS announced the $91 billion influenza vaccine. Now, let's talk about metrics here. The last item in the very bottom there. Over the next 25 years, we're talking about 6,800 new jobs and $41 billion in expenditure. So these are the kinds of takeaways that we want to talk about when we think about a plan. So at the end of the day, why do you develop a plan? To develop a shared vision, to build awareness, to identify your priorities, to recognize your near-term needs, which you do have, but align those with your long-term objectives, and finally, to chart a path for implementation so these things actually occur and that they ensure that your investments are made in a sound way.
Thanks, Stephen.